Here's today's Health Appeal.
Imagine a procedure that will dramatically enhance your eyesight without the use of a blade. If you are ready for the life-changing experience of LASIK, make sure you choose a surgeon that you trust. Dr. John Frangie from Northeast Laser Center is a board-certified ophthalmologist here to tell you more about no-blade LASIK. Dr. John Frangie, thanks for being here. Tell me a little bit about yourself.
Sure, Ashley. I originally am from Western Massachusetts, and I trained as a resident at Boston University and actually later taught at Boston University some of the techniques that we'll talk about today.
Now, we're talking about LASIK. Why do you find people get LASIK done or want to get LASIK done?
Really, there's a wide variety of reasons why people select to have their vision corrected. Frequently, it's something as simple as recreation, wanting to play in the pool with kids, go skiing, get a relative freedom in their life. Other people, it's occupational, whether it's law enforcement, pilots, even firefighters find it constrictive to have glasses on when they're working.
Absolutely. Now, how can someone know if they're eligible to get this procedure done?
Well, basically, the first thing is, what's your motivation for having it done? So oftentimes people will come in and say, I want to get rid of my reading glasses. My distance vision is good, but I want reading glasses. Those people really aren't candidates for LASIK. What we're looking for is someone who can't really see clearly in the distance. That is the purpose of LASIK. After that, you then need a medical examination to determine whether or not LASIK is a safe option that will serve you well.
Now, if someone comes into your office and says they want to get it done, what is their biggest hesitation?
Well, we know now from market analysis that the big concerns are fear and cost.
But after people get it done, I can say personally that everyone I know that's gotten it done has said it's changed their life.
It's very exciting because if you were requiring correction to see, as I used to before I had my procedure done, you had a ritual. If you're going to go jogging or if you're going to go skiing, you'd have to, okay, first I got to go get my contacts. Or if you're going to go travel, you had to have a separate case for your contact lenses, and then you need your sunglasses that you wore when you had your contacts on. But if you didn't have your contacts on, you need your prescription sunglasses. So there's a liberation.
Absolutely, and that's what everyone said. It's just like, literally changes their life. Now, tell me about no-blade LASIK, the actual procedure.
Well, no-blade LASIK is a specific type of LASIK that is state-of-the-art. Traditionally, when we were first performing LASIK years ago, we would require a blade to create a superficial flap on the cornea. We've learned through studies that we can do a better job by having two lasers. One laser that creates the flap and a second laser that corrects the vision. And in doing so, not only do we enhance the safety profile of the procedure, but we're also developing better results.
And there is a short video that we have. It's very short, but it kind of gives an idea of exactly how the procedure goes.
What we're seeing here is the no-blade laser creating the flap. It does so by putting millions of spots down side by side, creating a circular flap, and then we're able to remove the laser and under a microscope pick up the flap, at which point a second laser is able to correct the vision by gently contouring the surface of the eye.
So it's something that you don't even realize it's happening. You're not actually awake for this experience, are you?
Well, you're awake.
But you don't feel any pain. You don't feel
That's
something
correct.
Removing or lifting the flap. That's not felt.
Not at all. What you feel, and I demonstrate this to my patients, it feels as if I'm resting my thumb over their closed lids on their eye. So you really don't see anything coming towards you, and you certainly don't have discomfort.
Now tell me about your experience getting the procedure done.
Well, I had LASIK done some years ago, and at that time I was noticing difficulty with both distance and near, and I said, you know, I don't want to deal with having different apparatus, you know, be readers or bifocals or anything like that. So I underwent the procedure. I had a customization treatment, as this now is the standard that we perform, and I felt like I could see well almost within minutes, and I was able to drive the next day.
That's incredible. Now I was just going to ask you, what can patients expect after receiving the treatment?
Typically, most patients are able to drive the next day. Most of our patients can go to work. What we're mostly concerned is we don't want somebody to decide that they're going to get it done and then go to the beach the next day and jump in the water. The main thing is we want to keep you away from common water, pools, hot tubs, things like that for a few weeks until the healing's complete. We don't want to risk infection. Now that we've taken the blade out of the equation, infection's our main concern. Right after my procedure, as I mentioned, I was able to drive. I felt like I could operate, although I'd already set my schedule, so I wasn't going to operate for a week or two, so I could just make sure everything was perfect.
But the most important thing to note is there's nothing to be afraid of. It's not painful. If anything, the only thing that comes out of it is a better life, a better quality of life.
That's the goal.
Great. Thank you so much, Dr. John Frangie, for being here. We appreciate it. And I learned a lot about LASIK myself.
Well, thanks for the invitation.
Thank you. And for more information on how you can sit down with Dr. John Frangie to find out if LASIK is right for you, visit northeastlaser.net.
Here's today's Health Appeal.
Most people have heard of a cataract, but not everyone is sure of what it is or what causes them. Joining me now is board-certified ophthalmologist Dr. John Frangie from Northeast Laser Center to tell you all you need to know about cataracts. Dr. John Frangie, thanks for being here. So tell me exactly, what is a cataract?
Well, thanks for the invitation to come. A cataract is a change in one of the eye's natural structures, the lens, which is inside the eye. More importantly, what I'd like to tell you is what a cataract isn't, and that's something so many patients come in and they think a cataract is a film that grows over the surface of the eye. And they say, geez, doc, can you peel this cataract off? And what we actually do is we have to enter the eye and change the lens in the eye that has become hazy, and we replace it with a synthetic lens that is specified to that patient's own ocular contour and characters.
So I have to admit, I always did think it was a glaze over the top of the eye.
See,
so
I told you.
So exactly. So I just learned that it's not. It's something that's inside the eye. So it does require more than just scraping off an outer layer.
Well, first, we never use the word scrape when we're talking about eye surgery.
Sorry. Of course not. No scraping. No scraping.
But you're absolutely right. What it requires is actually delicately removing part of the eye's lens and maintaining its outer capsule or surrounding that subsequently serves as a support for the implant.
Now, what are the symptoms that people experience if they have a cataract?
Cataracts will universally present as a blurring of vision or problems with glare. Now, whether it's a blurring at near or distance or with driving at night, that depends on the type of cataract and its location.
So if a camera's out of focus and it looks little, that's kind of what someone may see, like everything's blurry.
That's one way it can present, absolutely.
Now, do these only occur in older people, or can younger people get a cataract as well?
It usually occurs as a result of aging. So the vast majority of cataracts occur in patients who are older. But we do see cataracts in young patients as a result of trauma, medication, radiation, and sometimes heredity.
So it's not impossible for someone that's younger to have a cataract.
That's correct.
Now, what are the treatment options available if someone does have one?
Well, typically, the options that patients can have are what kind of an implant or replacement lens do we put in the eye after we've taken the cataract out. There are lenses that give patients the ability to see distance and near, in essence, allowing them to restore their range of vision that most people lose as they get into their 50s and 60s.
So there are several different types of implants, depending on the person.
That's correct.
So there's not just one type of universal implant that you put in everyone. It does depend on the person and what they need.
That's correct. Your eye doctor will be able to tell you what lenses would best serve you, because not every implant will work well in every patient.
Right. Now, how serious is the cataract surgery? Is it something pretty involved?
Well, cataract surgery is the most commonly performed procedure in the country.
Oh.
It is a very delicate procedure, but perhaps one of the most safe and successful procedures that we have available to us now.
So we had talked about LASIK surgery and how fear is something that people have, but there's nothing to fear. Same with cataracts. There's nothing to fear, especially since it is so common and delicate.
Again, it's important to remember it is surgery, so we want to treat you with antibiotics. And as a surgical procedure, it has to be given the respect of that.
Right, of course.
But given how it positively impacts the ability of patients to stay independent, keep driving and such, it really is a rewarding procedure.
Yes, I can imagine just the feeling of seeing blur all the time, and then to not see things in a blurry way must be incredible. A relief, I can imagine.
Our patients are very happy.
Yes, I bet. Now, Dr. Frangie, tell me where you're located.
Well, we have a number of locations throughout Western Massachusetts. We have offices in Holyoke, Amherst, and Greenfield.
And Northeast Laser Center is in West Springfield?
It is, and that's our LASIK. That's our LASIK practice. And oftentimes we'll have patients who come in for a LASIK evaluation because they want to get rid of their glasses or contacts, and it turns out we find they have a cataract.
Oh.
And so we're able to manage them and get them into the appropriate office for the appropriate care.
As long as they get in touch with you and see you, then you're able to help them and direct them to where they need to go and what they need.
That's right.
Great. Thank you so much for being here. And for more information on how you can sit down with Dr. Frangie to find out how he can help you, visit northeastlaser.net.
Here's today's Health Appeal.
Cataracts are one of the leading causes of vision loss in the United States, but new technology is allowing patients to see clearly again. Here to tell you more is board-certified ophthalmologist Dr. John Frangie from Northeast Laser Center to tell you all you need to know about cataract surgery. Thanks again for being here. It's great to see you again.
Thanks for having me back.
So just to recap, what exactly is a cataract?
Well, as you mentioned last time, a cataract is when the eye's natural lens, which is located right behind the pupil, loses its transparency and becomes hazy, so light doesn't get to the back of the eye efficiently.
Are there different types of implants?
There are. As we mentioned before, there are implants that allow patients to get a range of vision called presbyopic implants. And there's also a specialized class of implants that allow patients who have astigmatism to finally have the astigmatism corrected so that they can see clearly without correction.
How common is an astigmatism? Is it for someone to have that?
Astigmatism is actually very common. In order for the eye to see clearly, the outer window of the eye, called the cornea, that's the surface where contact lenses rest on, should be a perfect dome shape. But with astigmatism, there's actually a slight or a severe oval shape to the cornea, so that light isn't focused to the same degree as it enters the eye. So different rays of light are bent to a different degree, so the eye never gets a nice, clear pinpoint focal point.
So how does this implant differ from, this specific implant for an astigmatism differ from others specifically?
Sure. Well, years ago, if you had astigmatism before surgery, you would have it afterwards because a cataract involves a different part of the eye. With these implants have a shape that's designed to correct the distortion on the outside. So when the cataract comes out, these implants go in as a normal implant would, but they also have the added quality of having a different curvature so that it can correct the distortion on the outer window at the same time.
That's amazing what technology can do to help correct someone's eyesight.
It's absolutely a significant improvement, and it probably has the highest patient satisfaction of any of our implants.
Now, what is the recovery time like after someone gets this implant, this surgery done?
Sure. After we perform cataract surgery, not only the astigmatism surgery, but the routine cataract procedure. Patients typically are very functional within a matter of days. It's not unusual for a patient to have cataract surgery on a Tuesday or Wednesday and be out golfing that weekend.
What is the response that people, what is the common response after they get this procedure done?
Well, it really is gratifying. People are very happy because you've restored a function that has been decreasing over a period of years. So this is really well accepted, and it's a nice procedure to be able to offer patients.
I can imagine. Now, what if someone's hesitant to get it done? They're not quite sure. What advice can you offer?
You know what? We tell them if you have any doubt, then there's no doubt. Don't do it. Wait till you're ready. There's no emergency or urgency, I should say, in having cataract surgery. It should be something that fits into your lifestyle because it's something that's supposed to make your lifestyle better.
Exactly, but bottom line is, it really does. I mean, the response that you've gotten has been that people are just saying their life is better. They can see clearly again. They can see clearly now. Is that right?
Absolutely.
That's wonderful. Thank you so much for telling me and our viewers all about cataracts and all of the treatment options available.
Well, thanks for having me again.
Thanks. And for more information on how you can sit down with Dr. John Frangie, you can visit northeastlaser.net.